Well, good afternoon, everyone. Thank you for joining us for Friday's COVID-19 situation report. Hopefully today's updates provide some positive energy to this unusually cool day, and I'm just in denial that there was actually snow out there today. But anyway, these are the moments that I think give us the opportunity to be grateful for the wonderful time of year that we are in, and when we do get the nice weather. So as we gather, let's respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so now I would like to invite Mayor Mitchell to start us off with some opening remarks. Please go ahead, Mayor Mitchell.
Thank you, Brittany. Ontario, like many jurisdictions, has presented a plan to gradually reduce COVID-19 related restrictions. These changes are predicated on achieving high vaccination rates and keeping case counts and other health indicators under control. To achieve these objectives, we all need to be vaccinated and to continue adhering to public health measures. Locally, we are making good progress on both fronts. These steps represent a path leading to a return to normalcy. At the same time, there is much work to do in starting to address the long-term consequences of 16 months of lockdown and to begin the process of building back better. I want to highlight 4 things I believe we should consider prioritizing. First, COVID has highlighted that societal inequities around income, housing, and food security have significant impacts on health outcomes. Although at Public Health we have known this reality for some time, as we work to avoid future pandemics, it will be important to continue to address these fundamental issues as part of the effort to prevent future outbreaks. Second is ensuring that the crushing impact of COVID-19 on our long-term care residents is not repeated. Although our residents are largely safe now because of vaccines, the government needs to expeditiously fulfill its pledge of more funding, expanded capacity, and increased oversight. We must never forget what was allowed to happen. Third is continuing to address the devastating impact the shutdowns have had on our business community. In some cases, a lifetime of work has been placed in jeopardy, and recovery is going to be long and difficult. It is important that the government continues to provide financial, marketing, and regulatory support to businesses, and that they provide them the opportunity to continue their important contribution to our community. Fourth is confronting the cost COVID-19 has extracted on our young people. For many of them, things of their youth have not simply been delayed, but lost forever. We need to address their mental health and well-being, and we need schools, as soon as it's safe, to resume their roles as places of academic, social, and cultural learning. These have been difficult days. Nevertheless, we have endured as a community. We will recover as a community, and we will thrive as a community. Stay safe, be well, and in all things, be kind. Thank you.
Thank you so much, Mayor Mitchell, for those salient and inspiring words today. Okay, let's move on to our current situation. So I'd like to invite Dr. Salvatierra to walk us through these next slides. Please go ahead.
Thank you, Brittany. Hello, everyone. So on the screen, you are viewing the current counts as of 4 p.m. yesterday, and you'll see that while the daily number of new cases continues to fluctuate this week, more cases have resolved, which has brought our active case count to 80. The good news is that the number of close contacts has also declined considerably and now stands at 206 individuals that are being followed by our contact tracers. This is 118 fewer than Tuesday's report. Sadly, we are reporting 2 more deaths since our last briefing. This brings to 20 the number of people in our community who have died from COVID, and I extend my condolences to all those families. Next slide, please. We're reporting 29 cases so far this week, and we hope to see this downward trend continue into the weekend. Next slide, please. As far as our active outbreaks go, we have some more positive news to share in that 3 outbreaks have been declared over, and that brings to 3 the number of active outbreaks in our community. The outbreak at Fairhaven is stable with only 3 cases, 2 staff members and 1 resident. The first round of testing was completed earlier this week, and a second round is being planned to take place very soon. Next slide, please. Here we give you active cases per 100,000, and we're showing you Peterborough and some of our neighbors. So we're the purple line there, and you can see that our weekly case incidence rate has fallen a little to 39 cases per 100,000, but that is certainly that's significantly lower than where we were last week. Good to see Durham's rate continuing to decline, and you'll notice that HKPR is up, and that is mostly because of the outbreak at the correctional facility in Lindsay. Next slide, please. Here's our most recent wastewater surveillance data from the Peterborough water treatment facility. And so pay attention to that green line because that's the normalized data. And you can see that since May 15th, it's been relatively lower. However, the last couple of testing dates have seen a bit of an increase. If you look at the red line, that's our active case count. And typically we run a few days behind the wastewater surveillance data. So I'm hoping we're not going to see an increase this coming weekend. But if we do, it will have been predicted by what we're finding in the wastewater. Next slide, please. Here's some data from our vaccination, and since last Thursday, we've seen a dramatic jump, and that's because we've really turned on the tap with our immunizations here in Peterborough, given the supply of vaccine that has been increased by the province. So more than 9,000 doses were administered in the past week. And that means that if you look at the pie chart locally, almost 59% of our eligible population has now received a first dose. And I believe we're on track to reach 60% by tomorrow, end of day. Okay, if we look at the bar graph, on the left, you'll see breakdowns of vaccination according to age. Last week, all of the age bands under 60 years of age had rates that were below 50%. You can see now that the 50 to 59 group has moved up. They're now at 54% of that cohort having received a first dose, and all of the other younger groups are catching up. It truly is great to see that our community is taking advantage of every single dose of vaccine that we can make available. So keep it up, Peterborough. You're doing great. Today, I would also like to focus on two recent announcements from the province with regards to second doses and to the immunization of our 12 to 17-year-olds. So I'll start with second doses. Last night, Ontario hit the 65% milestone. 65% of eligible Ontario residents have now had at least one dose of a COVID-19 vaccine. And so this morning, the province announced its second dose strategy. We have been assured that those of us who are not hotspots and who have historically received less vaccine per capita can now expect to receive more vaccine throughout the month of June to help us catch up. Starting next week. So we're still catching up with first doses, but if I can have the next slide, please, Brittany, you'll see that starting next week, May 31st, anyone who is age 80 years or over who has had their first dose can reschedule a second dose, an earlier second dose, according to local availability. Most of the over 80s do have their second appointments, but even if that's not the case, the provincial booking system will now allow people to book a single appointment. To do this, you must go online. If you're looking to rebook an earlier date for that second dose, or you can call the provincial vaccine booking line at 1-833-943 3900 for assistance for rescheduling. And I know that some of our 80-year-olds and over will need some help, and we no longer require our local call center. So the place to call is that provincial booking number. New appointments will automatically replace those that have been previously booked. But I just want to caution all the eager beavers out there that there are no appointments available today in Peterborough, and I don't know if there'll be any on Monday. So please be patient and just check back as we do post more appointments as soon as we get confirmation of vaccine, and if that happens over the weekend, we will be posting more for Monday. Starting on June 14th, you can see that the next group will be able to go, and that's the ages 70 to 79. And then every few weeks, as shown on this slide, there will be the opportunity for people to seek an earlier appointment for those second doses. And that will go according, if you look down the left-hand side, it'll be according to when your first dose was received. So you see, starting with people who were immunized between March 8th and April 18th, and then it opens up to those from April 19th to May 9th, and then from May 10th to the 30th. So those will open up, and that will be for everyone, including healthcare workers. The only healthcare workers that have gone ahead with second doses were the ones deemed to be at highest risk, and that has happened here in Peterborough. The hope is that by the end of August, 75% of Ontarians will have received both their doses of COVID-19 and will be fully protected. You'll see that the youth who are booking now will be scheduled to get their second doses between August 5th and the 23rd, so that they are fully protected by the beginning of the next academic school year. The province continues to increase the flow of both Moderna and Pfizer vaccines to pharmacies. And so hopefully more of our local residents will be able to access their first dose and eventually even their second dose from participating pharmacies as another option. Yesterday alone, our local pharmacies immunized almost 200 Peterborough residents with Moderna, and our primary care providers are busy this week and into the weekend offering a second dose of AstraZeneca to their patients who were immunized before March 20th. By September, pharmacies and primary care will be the major providers of the COVID-19 vaccines across the province. And for some of you, a pharmacy or your family physician or nurse practitioner may be closer and even more convenient. So again, you may wish to get your second dose there. With regards to youth vaccination, those who are aged 12 to 17 are currently able to book into any vaccine clinic that is not labeled, must be 18 at the time of the appointment. And we estimate that already 1/3 of our youth aged 12 to 17 have booked their COVID-19 vaccine. It didn't take them very long. So that's great to see. In an effort to ensure that all Peterborough youth will be vaccinated, we will be hosting youth-only clinics in the month of June. These clinics will only be open to youth aged 12 to 17. And so far, we've scheduled 3 of them for the Evinrude Centre here in the city for June 15th, 16th, and 17th. We are hoping to offer these youth clinics in other locations as well, including county locations, so stay tuned. Today, a letter will be sent from the school boards to families and students to let them know about these youth clinics, and they people will be able to book into them starting on Monday. We will also be sending an email out on Monday through our Notify Me program. So if you would like to know how and when to book into these dedicated youth clinics, please go to peterboroughpublichealth.ca /Notify Me and sign up for the 12 to 17 year age category for an email notification. Just so you know, clinics for Indigenous youth aged 12 to 17 have also been planned for early June. Those living in Curve Lake and Hiawatha First Nations will be contacted directly to book appointments there. And our urban Indigenous youth will be able to book into clinics here in the city that will be co-led by our Indigenous community partners. So that's it for me right now, Brittany, and I'll pass it back to you.
Thank you very much, Dr. Salvaterra. Okay, so I believe we'll hear now from our elected officials, and it looks like our MP Mary Monsef is able to join us. Thank you for squeezing us in. I understand you're in the midst of question period there, so thank you. And I will try to spotlight you. My computer's being a little difficult today, but according to me, it says you're spotlit, but please just go ahead.
I appreciate you, Brittany. Hello, everybody. Bonjour, Ani. Salam alaikum. I'm on Mississauga and Anishinaabe territory here in my home. And yes, I was in question period, so I don't know if I missed any weather jokes about snow in May, but there was snow today, and I'm cold. And I sincerely want to begin today's update with gratitude for paramedics, first responders. This is a week where we get to celebrate and thank you for your service, for your compassion, and for all the ways you know exactly what to say and what to do to keep people calm in moments of distress and get them to other caring professionals. We recognize just how much your job has changed because of COVID for you and for your loved ones. We know that we have asked a lot of you, as we've always had, but you have stepped up above and beyond the call of duty during this pandemic. To every paramedic out there, thank you, thank you, thank you. We appreciate you, and we truly hope that we get to a day where the workload you have to deal with becomes much less intense, and we all play a part in that. I'll focus my remarks on vaccines and thank Dr. Salvatore and the team at Public Health for their ongoing excellent work, and Chair Mitchell for your leadership. To date, 26.2 million vaccines have been distributed to provinces and territories. 22.3 million have been administered. Here in Ontario, the government of Ontario has received just over 10 million vaccines and have administered 8.6 million doses. That gap of 1.4 million doses to be administered. We thank everybody, including immunizers, for moving as quickly as possible to vaccinate as many as possible. You probably heard too, colleagues, yesterday that the Government of Canada confirmed the next 2 Moderna shipments. Next week, we anticipate receiving 500,000 doses. And during the week of June 14th, which is just around the corner, we'll be receiving another 1.5 million doses, which means over the next 3 weeks, we expect to receive about 2 million doses of Moderna. This, of course, is over and above the Pfizer vaccines that continue to arrive into Peterborough weekly. And while we finalize the shipments for Moderna for the second half of June, my colleague, Minister Anand, who's responsible for vaccine procurement, is in constant communication with all vaccine manufacturers, including Moderna, and they have assured her that millions of more doses will arrive in Canada during the second half of June. With just confirmed shipments alone, this means that over the next 5 weeks, Canada is receiving 14 million more doses of vaccines, including 5 million right here in Ontario, which, based on the province's current allocation methods, should mean somewhere between 45,000 to 50,000 doses here in Peterborough. I know people are restless, but we are so close. May is over. We're approaching the final week of May. We're close to vaccine levels where we need to be so that restrictions can be loosened and that we could start to have a calmer summer, a more enjoyable summer. So if you haven't already, please get your vaccine. The best one for you is the first one available to you. Keep talking to your circles of friends and loved ones about why it's important to get the vaccine. And Brittany, I hope you get a weekend free of devices and free of tech glitches. Back to you.
Thank you so much, MP Monsef, and great news always to hear about the increasing supply. We're so grateful for everyone's help at the federal level for that. Okay, I think that is it from our elected officials as I just look quickly. So let's move on to our questions from our media guests. So to kick us off today, Paul Rellinger, did you have some questions for any of our speakers today? Oh, and I should just mention quickly, we're fortunate to have some of our enforcement partners with us from the Peterborough Police Service and the OPP. So please go ahead, Paul.
Yeah, thank you so much, Brittany. Just for Dr. Salvatore, just one question. I hate to be the one to bring it up, but do you have any details at all on the 2 deaths this week? Anything more you can tell us? Were they residents or were they in homes, gender, anything at all?
I believe some of that information is available publicly. It's reported by the province, and if you don't have that link, Paul, Brittany can certainly give it to you. Both of the deaths this week were people that were living in the community, and that's really, you know, all I can share. I understand that the latest death has been identified in social media, so I'm not going to, you know, share any personal health information. But needless to say, very, very tragic for those families.
Thank you. The only thing I would add to that, do you know if they had received vaccinations or?
Well, I think if we look back at those, most of our recent deaths in Peterborough have been people who've been immunized, because we've been immunizing those age groups since the beginning of March. And when I review the details, it's usually one of 2 scenarios. Either they've been immunized and then they're exposed and infected within days so that they haven't had time to mount an immune response, or they have an underlying condition that has interfered with their ability to mount a protective immune response. So that tends to be what we're seeing in those people who are becoming ill despite having had an immunization.
Thank you for that. I know that's kind of difficult to talk about for sure. Just one more thing. During the last briefing on Tuesday.
Oh, I lost you.
At stage 1 of the reopening. Oh, I'm sorry. Can you hear me now?
Say that again. I can hear you now. Yeah.
Oh, I'm sorry. During Tuesday's briefing, you indicated there was a possibility in your mind that stage 1 of the reopening could begin earlier, possibly when the lockdown or stay-at-home order ends. Is there any more clarity on that? Do you have more reason to believe today that might happen?
Well, I did ask at a provincial call just yesterday whether the intention was that, you know, either the stay-at-home will be moved and extended, or step 1 can be moved up. And that indeed was confirmed, that is the plan with reopening. Either we will need to extend the current stay-at-home because we're not able to open up and that's because indicators are not where they need to be, or we might be in the position where we have a good reason to move ahead. So it'll be one or the other, I believe.
So if you're in Vegas right now and you're laying down $50, which based on the numbers as they are today, what's your gut feeling?
I've been watching the provincial, and it will be a provincial decision, Paul, right? Because we're not going back to the regional framework, but I've been watching those numbers every night, and they are consistent. They're still above 1,000. But they are they're staying at about just above 1,000. I think we need to see those go down below 1,000 and stay there for enough of a time that there's more of a indication that we are continuing to head down. And that's, I think, what we'll need to see before the Premier feels confident in taking us into the next steps of reopening.
Perfect, Dr. Salvatore. Thank you. I'm sorry to make that difficult for you. I appreciate it very much. Thank you, Brittany. That's all I have.
Okay, thank you very much, Paul. Okay, let's hear from Bill Hodgins from Peterborough this week and my Kawartha. Do you have some questions for our speakers today, Bill?
2 for Dr. Salvatore, please. Just curious, in particularly in the States, but in other places in Canada, we're hearing incidents where they're expecting more people to show up than are actually showing up for their immunization. I'm wondering if expectations here are being met, or are some people being more apprehensive that you didn't expect?
I think if you look at the trajectory here in Ontario, Bill, we're breaking records. I mean, we are continuing to see really brisk uptake of vaccine. We anticipate it'll slow down at some point, as it has in the US or even in Israel, but it hasn't. And in fact, we are surpassing some of those other jurisdictions that were out of the gate ahead of us. So it is so encouraging right now to see the interest in immunization, and frankly, I just hope it continues. Right up until the end. As I said, we're hoping that by the end of August, we will have at least 75% of everyone with both doses, and I think we're well on our way.
That's good news. The other question has to do with the youth, the 12 to 17. There was some confusion last week in some areas of the province whether those young people needed parental consent before they decided to get here. And I could be wrong, but as I understood it, they were leaving it in the hands of each individual health unit to make that decision.
Yes. Oh, sorry. Go ahead. Finish.
Yeah. No, just wondering what the policy was here.
Well, Ontario does not have an age of consent. And so the way it's always worked in Ontario is that if a young person can demonstrate that they understand both the risks and the benefits, and that we do honor their decision. So they are able to provide consent on their own. And that's the way we've always operated. We run vaccination clinics here, and youth can come and ask to be immunized. Where it has not worked that way traditionally has been in the schools, and because we do immunizations in the schools as well, and the school boards have been much more comfortable here with an opt-in process. So we do send consent forms home, and those consent forms need to be completed by the parent or guardian and then returned to us. But we're not operating that way right now for COVID-19. If a youth books an appointment, comes in and is able to give us informed consent, they can be immunized on their own word.
Perfect. Thank you. That's all I have for today.
Thank you, Bill. And I'd just like to draw our guests' attention to the chat thread where my colleague Sarah has included a link to the Ontario data catalog tool, which does include all of the case information for every health unit. And that's where you can find more details if you're curious on specific cases. Okay, so joining us, we have Danelda Fraser from the Havelock Rail. Thank you for joining us from Havelock. Do you have any questions today for our speakers, Danelda? Oh, it looks like maybe she's popped off. Sorry about that. Let's move on then to Joelle Kovach from the Examiner. Joelle, do you have some questions today?
Yeah, thank you so very much. Dr. Salvatierra, I wondered, okay, did you say earlier, I just want to clarify, that some local doctors who had been part of that pilot program in March for the first doses of AstraZeneca, indeed, did they get some second doses? Yeah.
Yes.
Okay.
Yes, and these are the doses of AstraZeneca that are expiring on May 31st.
Okay.
We were able to get 200 doses here in Peterborough, and family physicians and nurse practitioners have made those available to their patients who were immunized before March 20th. They had to be immunized by March 19th to qualify for this first batch. And I understand that has been very good pickup. And in fact, there will be immunization going on this weekend as well to use up all 200 of those doses.
Okay. Now, the first dose, like the first shipment that arrived for that pilot was more than 200 though, right? This is in
Oh,
no way.
yes. Oh,
Yeah.
yes. I mean, here in Peterborough, primary care immunized more than 5,000 people for the whole duration of that pilot.
Oh, okay. So if you didn't hear back from your doctor, you're gonna get some later instructions about it.
Yes, we
Yeah.
are expecting for the rest of those 5,000 people, we're expecting that they will have a choice. Definitely they will be able to opt in for AstraZeneca as a second dose at 12 weeks, which will be coming up in June. And there is an informed consent process for doing that. And we're still waiting to hear from NACI whether the other option might be to get one of the messenger RNA vaccines, either Pfizer or Moderna. And so that's the way I believe it's going to go, Joelle, but I know that we're still waiting for for NACI to make that recommendation.
Right. So at around 12 weeks, there's still a possibility that some AstraZeneca could show up. It sounds like, but it's
well, we're actually planning for that right now. We are planning that at 12 weeks, primary care will be offering AstraZeneca to their patients who want it as a second dose. And we're just, I mean, we haven't got confirmation yet of amounts and when they're coming, but we certainly have had indication from the province that AstraZeneca will be arriving here in June.
Oh, okay. That's great news. All right. So one way or another, sooner than later, we'll find out what the plan is for these people. Wonderful. That's great. Thank you so much for that answer. I noted this week that, and I know this is a hospital question, but it does have a public health link. I noted that there's at least one patient that arrived at PRHC critically ill with COVID from Winnipeg. Now, if a person who's a transfer dies, does that count? Like,
I mean, it counts. Yeah, it counts to their family, but they don't get counted in our numbers.
That was a question. Yeah.
Okay, so our dashboard only reflects Peterborough residents. And so you may have seen that on May 26th, we had 8 of our active cases who were hospitalized, and 3 of those were in the ICU. We don't specify where because there is a lot of movement in the province right now, but we do let you know how many of our patients are critically ill, and we only report on our patients.
That's helpful. Thank you very much. Yeah. The other one I wondered about, I'm seeing now there's a whole lot of new pharmacies that have become, that have been added to the list. Most of them are offering Moderna. So do we keep watching? Because there seems to be start and stop Moderna.
Well, yes, the plan is that by the end of the month, which is soon, just around the corner, that all of the pharmacies, and I believe there are in total in Peterborough, there'll be 26, I believe, pharmacies will be offering either Moderna or Pfizer. And I certainly hope to see them getting more Moderna and Pfizer each week because they tend to run out pretty quickly. And for many people, the pharmacy is so much more convenient because it's just around the corner and it may be even open late. So pharmacies are going to become a key place for COVID-19 immunization as we move further into our vaccine rollout.
Wow, that's an amazing availability all of a sudden. Thank you for noting that. And the last thing I was wondering about is, we talked a few weeks back about church gatherings. Has there ever been any cases traced back, or there's never been an outbreak linked to there? Has there?
You mean in Peterborough? I mean, definitely in Ontario, yes.
Okay.
And we know church, and in fact, even in the literature, there have been published outbreaks and deaths, especially related to singing. in church congregations and in churches and in choirs. So we definitely know that it is a risky environment. As far as whether we've had cases here in Peterborough, that I'm not sure, Joelle. I'd have to check with staff. And then, of course, it's always dependent on staff, on cases telling us, right, and remembering all of their potential exposures. So I wouldn't put it down if we don't have something that's directly attributed. It may not mean that it hasn't happened, and just that we haven't been made aware of it.
Got it. Thank you very much. Understood, and I'll pass it on to my colleagues. Thank you.
Okay.
Great, thank you so much, Joelle. Lots of great questions today. I'll invite Reg Watson to also offer up some questions to see if there's anything else from the examiner today. Any other questions, Reg?
A question for Dr. Salvatierra. Could you clarify on the second doses of the AstraZeneca? Is it optimal for people to get the second dose after 12 weeks?
Yes. And that's because we've had emerging evidence to show that at 12 weeks, there's a much better immune response to the AstraZeneca vaccine. So even though it can be offered earlier, I mean, the product monograph suggests it can be given between 4 and 12 weeks. Typically, that's what the clinical trials did. But the actual evidence now from the millions of doses that have been given is that the best time is 12 weeks.
I also asked, many or most who got the first dose of AstraZeneca in our area may have got it through pharmacies. So how is it going to work with the pharmacies that have now switched to Moderna and Pfizer? Will people still be able to get second doses of AstraZeneca from the same pharmacy that they got the first dose from?
Right, that's a good question. I don't know. I mean, if we did have pharmacies that it did AstraZeneca here in Peterborough, there weren't many, but it is a good question, and we'll take that back because I haven't heard. I don't have an answer, but I'd like to know myself.
Okay, thank you. Also, one final question for Constable Ayad, if he is on the line. Any plans for monitoring the Burley Falls Crown Land this weekend, even if the weather is a little cooler?
Yeah, we'll be out there. We've been patrolling every day, as well as conservation officers. I believe conservation officers actually laid a couple of trespassing charges last weekend. So we're out there multiple times a day to Burley Falls, and we're also increasing patrols as the weather gets nicer. Not so much today, but as the weather does get nicer, to areas such as Sandy Beach, Jones Beach, and the Chemong Lions Bridge North, where there's been issues arising. So we'll be out there every day, like we always are.
Okay, thank you. And just to clarify, there were no further charges so far this week?
No, officers were out to the Chemong Lions Park and Bridge North. There was a complaint out there yesterday evening. Officers attended and dispersed some fishermen that were from out of town. There were no issues, just some education given, and there was no issues. They dispersed immediately and were told to come back once the stay-at-home orders lifted.
Oh, okay, thank you. And then to city police, have there been any further charges over the past week that you haven't been aware of?
Staff Sergeant Dan McLean here. Not aware of any further charges regarding anything related to COVID-19. I haven't been made aware of it.
And are you expecting the usual demonstration at City Hall on Saturday and any church gatherings that you expect to monitor over the weekend?
Yes, we expect that there will be some people gathering in front of City Hall as usual. As I stated before, the gatherings have been occurring, I think, for some time now, since January or even before January. So we expect that there will be some gatherings. As far as the church service, I'm not aware at this point, but we do continue to monitor that situation and will respond accordingly.
Okay, thank you. That's everything for me, Brittany.
Okay, great. Thank you so much to our enforcement partners and Reg for those questions. Okay, let's hear from Matt Latour from our local radio stations. Do you have some questions today, Matt? Well, it looks like Matt may have had to drop off as well. All right, well then, I see Jessica Niznik is here with us from Global News. So please go ahead, Jessica.
Of course, Brittany, I wouldn't miss it. Just for Dr. Salvatierra, one quick question about the family clinics. Dr. Salvatierra?
Yeah, there we go.
Okay, there you are. I didn't see you.
No, my camera was stuck.
It's a day today for technology to just fail us, it seems. I'm having troubles on my end too. Are we still looking at doing those family clinics in mid-June?
Well, we were told to do family clinics. That was about a week ago. And then there was a change in direction from the province. And instead, they advised us to do youth-only clinics. So that's what we've done, Jessica. We are going to be offering youth-only clinics. So 12-year-olds to 17-year-olds will be able to book into these clinics. And they will be put online Monday. For the first 3 will be available on Monday for bookings.
Yeah, I wondered if they're doing that now, then why would they still have that? And when you say youth clinics, does that mean it's going to be like a day just for youth, or will it be mixed in with everyone else?
No, it's a clinic just for youth. So they will have their own clinics and they can book into them.
And it'll still be at the Evinrude, or?
For the first 3 are scheduled at the Evinrude. But we are still looking and talking with our school board partners to see where else we might need to set up these youth clinics.
Okay, that's it for me. Thank you, Dr. Salvatierra. Have a nice weekend.
Welcome. Thanks.
Great. Thank you so much, Jessica. Okay, and I'll just check in. I think I see Donelda Fraser is back on the line with us. Did you have any questions, Donelda, from Havelock?
No, not today, thanks. And everybody have a good weekend.
Okay, great. Thank you. All right. Well, I think that brings us to an end then. So thank you all for joining us. Thank you for your great questions, and thanks to our elected officials and our police partners for always making yourselves available for these media briefings. Have a safe weekend out there, and we will see you back here on Tuesday, June 1st. Okay, take care, everyone. Thank you. Bye-bye.
Thanks, everybody. Have a good weekend.
Thanks, everybody. Take care.